Hi everyone, myself Dr. Suresh Giragani, Interventional Radiologist at Yashoda Hospital, Secunderabad. Today I am going to describe about one of the interventional treatment options for liver cirrhosis, that is called as TIPSS. So when TIPSS is done, TIPSS is nothing but a kind of stent or shunt creation between the veins of the liver, which include the portal vein and hepatic vein, also called as transjugular intrahepatic portosystemic shunt. So in case of normal liver, whatever the food we have, the nutrients that are absorbed from the intestine are carried into the liver and filtered into the liver through the pathway called as portal vein. It's a kind of vein which absorbs all the nutrients from the intestine into the liver, and the nutrients get filtered here, and all the impure blood goes into the systemic circulation or to the heart by means of three veins called as hepatic veins. So in case of this is about normal liver. In cirrhotic livers, liver becomes cirrhotic in case of alcoholic hepatitis or hepatitis infection or NASH related cirrhosis. These are all the causes of cirrhotic liver. In cirrhotic livers, liver becomes small, shrunken and stiffened. So because of the stiffness, naturally the filter mechanism, the perfusion mechanism or perfusion filter mechanism of the liver will come down, and whatever the blood that is being carried from the intestine into the liver becomes stagnated, and there will be a kind of back pressure changes which lead to swelling of different veins in the portal bed, which includes the varices that can cause bleeding from the mouth or black stools. The other symptom is excessive water formation within the abdomen called as ascites. So these are the two predominant symptoms of the portal hypertension due to cirrhosis of liver. So what are the treatment for this portal hypertension secondary to cirrhosis of liver? This include medication that decrease the portal blood pressure or portal hypertension, and the swollen up varices can be treated with variceal banding, and the excessive water formation within the abdomen can be treated by medication, as well as tapping, that means removal of the water whenever it is excessive. So these three conventional treatment options work in most of the cases. In cases which are not responding to these conventional treatment options, there are two treatment options. One is TIPSS, the other one is liver transplantation. The TIPSS is wherein we place a stent between the portal vein and the IVC, so that the blood pressure within the portal vein will be decreased because of the shunting of the blood from the portal vein away directly into the hepatic veins and IVC. So this is called as TIPSS, and in few cases of TIPSS may require liver transplantation as well further. So before taking a patient for TIPSS procedure, we evaluate the patient with few clinical as well as biochemical parameters, which include most important of which is a liver function test. In the liver function test, we assess the bilirubin levels as well as the PT-ANR and albumin levels. And few cases of cirrhotic livers, especially patients who are excessively forming the water in the abdomen, they have deranged kidney functions also. So we assess the serum creatinine and serum sodium also. Out of these parameters, we draw certain scores called as CHELP score or MELD score, and they are in certain range. The patients will benefit from TIPSS, or they are going to have good prognosis after TIPSS or transplantation. So apart from these, we assess the patient's hemogram for the platelet count, hemoglobin and white cell count as well. So this is one case example. As you can see, the patient is having tense abdomen due to accumulation of the water within the abdomen due to cirrhotic liver, and this patient underwent TIPSS as it was refractory for the conventional medication. So as I said, the indication in this case was refractory ascites. So how it was done? It was done through the transjugular route. That means a small nick is given through the neck, and the entire procedure was done. The purpose was to basically to decrease the portal pressures. The patient has to stay in the hospital for 2 days at least, and the procedure duration is for 2 hours. And anesthesia is generally under sedation. Does not require any general anesthesia. Usually it is under sedation. So as I said, the procedure is done through the neck. As you can see here, I was standing at the head side of the patient, and a small tube is inserted through the neck, and the entire procedure is being done under fluoroscopy or angiographic guidance. So this is a fluoroscopic video just to have a knowledge of how the things are done. Though through the sheath that was introduced through the neck, a small needle is introduced into the liver between the hepatic vein and portal vein. As you can see the needle here. Once the needle is introduced, we confirm the access. This is the portal vein, and after that a stent. This is stent, the graphical representation of stent. So this is a stent that was deployed, as you can see here. So that diverts the entire blood away from the portal vein into the liver. So this is a successful placement of the stent in the case of portal hypertension. So after the procedure, we assess for possible complications including the hepatic encephalopathy, bleeding, infection, and we assess the patient post-operatively with the help of ultrasound scan to check for the functioning of the stent. In this case, patient was there in the hospital for 2 days and discharged on the 3rd day. And as you can see that there is a small bandage over the neck. And this is about the TIPSS procedure, post-procedure care, and overall treatment aspects. Thank you for attention.